This fella is known as a zygous vein. A zygous vein. Well, Mr. Gilmore, since you're doing veins, how about you tell me what this one is? Here it is, I got a vein, Mr. Gilmore. And this vein is on the bottom of the heart. His name is inferior vena cava. Inferior vena cava. So, Mr. Gilmore, go back to the arterial supply, because we got all that. I'm going to pull the heart over, pull the lungs over, and we're going to do something where we can hopefully get everybody on one accord. We're going to do something unique. What are you going to do, Mr. Gilmore? Let me see if I can do this real quick. Don't do nothing different, man. You're throwing me off. I'm going to show you something, because I want y'all to follow this. Here it is, Mr. Gilmore. We got this cute cartilaginous thing we call the what? Trachea. We're going to pull the trachea to the side. What's behind the trachea, Mr. Gilmore? Esophagus. This esophagus, Mr. Gilmore, comes on down, comes on down, comes on down. Well, Mr. Gilmore, if that much is true, I should be able to tell you exactly what these structures are coming off descending thoracic aorta. If this is descending thoracic aorta, Mr. Gilmore, right? I got some vessels that's coming up here and it's going in between these ribs. Those are going to be called intercostals. If those are intercostals, Mr. Gilmore, you said there was this little flat tube right here that goes toward the stomach. His name was esophagus. So if that was true, what's these branches going to him? Esophagus. Those are esophageals. Those are esophageals. Okay, Mr. Gilmore, I got that much. How about you keep going on down? This is where I was having a little problem at. I just didn't want to say nothing because I thought somebody else was going to say something. All right. Let's get this right. What I would do, Mr. Gilmore, is I would take this, spread it out so it looks just like the picture. And by doing it, I can't get this wrong. Now, whoever did this right here, they started, but they ain't finished it off for me. But it's okay. We're going to make it work. We're going to make it work, Mr. Gilmore. Now, clean it up, Mr. Gilmore. All right, that's a little bit better. Now, I'm going to put everything where it's supposed to be. Here's what I want, Mr. Gilmore. I want you to tell me specific structures I need to know. This first branch, celiac. This next branch, superior mesenteric. This next branch, inferior mesenteric. In that order. If I know that, Mr. Gilmore, I know the roadmap. No matter what you say, I know the roadmap. Because I know the first major branch coming off of this, Mr. Gilmore, can you see that? Okay. The first branch that's coming off this, Mr. Gilmore, going to the liver. So his name is hepatic. The second major branch, Mr. Gilmore, coming off of this, his name is splenic. The third major branch that's going to come off here, Mr. Gilmore, is going to be gastric. Well, if I got that much, Mr. Gilmore, what's this? Superior mesenteric. Well, what is it going to innervate, Mr. Gilmore? Well, we found out we got a lot of little vessels up in here. All those little vessels, no matter what I do, Mr. Gilmore, if I put a tag on any one of these, because they go into the small intestines, you can call those what? Intestinals. Okay, I got that much. But Mr. Gilmore, this fellow right here we call inferior mesenteric. So if I tag it along this way, that's going to be what? Colon. But Mr. Gilmore, what if I tag this one that's going down? He's going toward the hemorrhoids, so we call it what? Superior hemorrhoidal, because I'm going toward the buttocks. But Mr. Gilmore, hold up now. How about you walk me through these glands or organs, so to speak, because I don't remember this and it's been a minute. So let's do this right here real quick. We'll notice this cute little thing right here, no matter what lobe it is, it's still the what? Liver. This little green thing inside here, Mr. Gilmore, is the what? Gallbladder. This little muscular area on the top, Mr. Gilmore, that's the breathing muscle, his name is? Diaphragm. Now watch this right here. Mr. Gilmore, this is what I want you to do, because This is where I was being confused at. Tell you what. You see this little stuff right here? His name is lesser omentum. This is lesser omentum. This is the stomach, Mr. Gilmore. We got that. So if you put a tag right here, leaving from the stomach, going to the small intestines, this has to be the what? The duodenum. Well, what if I ask you what sphincter this is? This is the pyloric sphincter. No big deal. But Mr. Gilmore, I need you to tell me what this little flat thing is right here that's found right under the small intestines. You see this little fellow right here? That's the pancreas. He kind of looks like a brisket. Man, you gonna make me not want brisket. Okay? But that's what he looks like. Brisket. Now, Mr. Gilmore, what is this? Watch this right here. I'm leaving from the small intestines, going toward the colon. What if I put a tag right here? If I say a valve, you can say ileocecal valve. If I say what specific point, Mr. Gilmore, you're going to say cecum. All right? Got that much, Mr. Gilmore. This right here, colon. This right here, small intestines. But Mr. Gilmore, let's get back to these arteries. If you know that chart, you can't get this wrong. Watch this right here. I'm going to hook you up by doing this. If I put a tag at the top of the kidney, and it's this vessels right here that has been cut out. If I put it at the top of the kidney, Mr. Gilmore, that's adrenal lumbar. If I put it at the renal pelvis, it's going. If it's blue, it's going to be renal vein. If it's red, it's going to be renal artery. But Mr. Gilmore, what if I put a tag right here and ask you what vessel is on the diaphragm? You're going to say phrenic, because phrenic is what innervates or what gives the blood supply to the who? Diaphragm. Well, Mr. Gilmore, hold up. What if there was an ovary over here, Mr. Gilmore, and then it had a branch going over there to the ovary? You're going to just say ovarian artery or ovarian vein. Now, Mr. Gilmore, what's the part that leads the ovary going down? That's going to be the uterine tube. The uterine tube. Well, Mr. Gilmore, hold up now. What's this thing right here going over here and throwing the P sound over like this lumbar region? That's going to be iliolumbar. Well, Mr. Gilmore, what's this big large one right here?
External iliac.
This fella is going to be external iliac. The one right medial to it is internal iliac. And the one right in the middle, Mr. Gilmore, his name is who? Caudal. If that much is true, Mr. Gilmore, I am looking in the leg. This is what I want to do. Make sure everybody gets look, this is what I'm going to do now. What happens if there's a branch coming off of here, Mr. Gilmore? What you going to call him? Deep for more. After deep for more, Mr. Gilmore, I'm going to change my name to who? For more. That's for more. But Mr. Gilmore, what happens when it goes long and goes to the length of the leg? Saphenous. Going behind the knee, Mr. Gilmore, you ain't going to tag it on this side. Nope. I turn the cat over and tag it. That's going to be what? Popliteal. But after popliteal, Mr. Gilmore, there's one that goes to the front of the leg. We're going to call it what? Anterior tier. There's one that goes to the back of the leg. Posterior tier. That is it. This ain't hard. If you take your time and put in the